Not too long ago, we shared the story of American Idol alum, country singer Bucky Convington, and his daughter Kennedy, who was born with a painful type of tumor, infantile hemangioma. Here's their story.
My name is Bucky Convington. I went out on American Idol. It did really well for me. Released an album. It debuted at #1.
My name's Catherine Cook, and this is our lovely daughter, Kennedy. The moment she came out, the first thing Bucky said is, she's gorgeous. I think her arm's bruised, but she's perfect. So within maybe a week, it started to swell and just gather blood.
She was bawling, and you know why. You know, I mean, it's heartbreaking. Something had to get done quick because it was not getting better.
And so we went back in to see our pediatrician, and he said that he did think it was an infantile hemangioma.
When this first starts coming to the table, you're scared to death. I don't know what to do.
She's receiving what we call an off-label use of a medicine, propranolol. Now it's a beta blocker. We're joined via satellite by pediatric otolaryngologist Dr. Steve Gowdy. Was this almost an incidental finding, figuring out that propranolol actually may help reduce these hemangiomas?
That's exactly right. Pediatric cardiologists or heart doctors identified that patients that were on this medication for their hearts had these large hemangiomas that almost vanished.
And that's the best part of this, because it's a fairly benign medicine if used appropriately. And without further ado, can we meet Kennedy? Look at Kennedy! And we just hope that she has quick resolution. Bucky, Catherine, thank you for being here. A few birthdays have passed. It's time now for a doctor's checkup. Co-parents Bucky, Catherine, their daughter Kennedy, join us via Skype from Tennessee. Hey, Kennedy, how old are you?
3.
3? Last time I saw you, you were so small on this stage. Bucky, I want to ask you how Kennedy has changed since we last saw you.
Man, it's been absolutely wonderful. Of course, you've seen from the video, when she was born, it started off like a little bruise, and it got quite swollen, really purple, and bleeding at times, and just painful. And today, as you might can tell, it's just a light pink. I mean, just about as normal as you could be. So we've been just absolutely happy and so happy with you.
And that's so typical of and you know, this is the most common congenital deformity that kids get, these vascular malformations.
Right.
And parents are so concerned when they see their child as things starts developing. Right. The good news is, in most cases, it does regress, just like Kennedy's case.
Yeah, a lot of times, but some of them can require treatment. Like in Kennedy's case, had hers not been treated, then it would have continued to grow. So we're really happy that this treatment was effective.
Now, is it true that Kennedy enjoys the ballet?
She does.
She is, she's quite the dancer. She loves dancing. Of course, right out of the gate, we know she's twirling all over the place. But, you know, one of the first things you notice, she just had her first recital maybe a couple of weeks ago. And when I first showed up, you notice really quick, all the outfits are sleeveless dresses. You know, that could have been a very devastating moment for my daughter. Instead, it was an absolutely amazing moment for my daughter, and she did absolutely wonderful, which also lets you know that during rehearsals, she was able to just be normal and learn how to dance.
Oh.
That's awesome.
And before we let you go, it sounds like the dog is begging for some camera time. What's the dog's name?
The dog's name is Louie, and he begs for any attention whatsoever.
Louie, you got your moment in the sun, our friend.
Yeah. And I do want to ask, I heard that Kennedy calls the spots on her arms, she has a special name for them now.
Kennedy, what do you call it?
Angel kisses.
Angel kisses? Yeah.
Kennedy, we want to thank you so much for coming back on our show, and we're so happy that you enjoy the ballet. Keep doing great, and certainly Catherine, Bucky, thank you for sharing Kennedy's story with us.
Thank you, guys.
Thank you for bringing us.
And if you're watching and want more info on Bucky Convington's latest music, we'll have that information on our website, thedoctorstv.com.
And, you know, just a final comment, these very common congenital lesions, they do start growing, but in most cases, with non-invasive treatments, will regress on their own. Propranolol worked in this case. Lasers sometimes work. They do embolization. But the good news, in most cases, most kids, they do just fine.